Welcome to another video. This video includes 10 nursing practice questions to teach you how to master the NCLEX. At the end of the video, check out the description for studying resources and more. Practicing nursing questions frequently is the best way to pass many nursing exams. Now let's begin. Starting with question 1. A 30-year-old client is exhibiting auditory hallucinations. In working with this client, the nurse would be most effective if the nurse encourages the client to discuss the voices, attempts to direct the client's attention to the here and now, exhibits sincere interest in the delusional voices, gives the medication as necessary for the acting out behavior. The correct answer is attempts to direct the client's attention to the here and now. This answer is correct. The nurse should appropriately present reality. A 2-day-old infant boy has been diagnosed with an atrial septal defect due to a persistent patent foramen ovale. When explaining the diagnosis to the mother, the nurse includes in the discussion the function of the foramen ovale. In fetal circulation, the foramen ovale allows a portion of the blood to bypass the left ventricle, pulmonary system, liver, superior vena cava. The correct answer is pulmonary system. As the blood shunts from the right atrium to the left atrium, the pulmonary system is bypassed. The fetus receives oxygen from the maternal circulation, thereby permitting the partial bypass of the pulmonary system. A client diagnosed with severe anemia is to receive 2 units of packed red blood cells. Prior to starting the blood transfusion, the nurse must take a baseline set of vital signs. Hang Ringer's lactate as the companion fluid. Use microdrip tubing for the blood administration. Have the registered nurse in charge assume responsibility for verifying the client and blood product information. The correct answer is take a baseline set of vital signs. A baseline set of vital signs is necessary to determine if any transfusion reactions occur as the blood product is being administered. A 48-year-old client is being seen in her physician's office for complaints of indigestion, heartburn, right upper quadrant pain, and nausea of 4 days duration, especially after meals. The nurse realizes that these symptoms may be associated with cholecystitis and therefore would check for which specific sign during the abdominal assessment? Cullen's sign, rebound tenderness, Murphy's sign, Turner's sign. The correct answer is Murphy's sign. This sign is considered positive with acute cholecystitis when the client is unable to take a deep breath while the right upper quadrant is being deeply palpated. The client will elicit a sudden, sharp gasp, which means the gallbladder is acutely inflamed. Pin care is a part of the care plan for a client who is in skeletal traction. When assessing the site of pin insertion, which one of the following findings would the nurse know as an indicator of normal wound healing? Exudate, crust, edema, erythema. The correct answer is crust. Crust, dry, scaly, is part of the normal stages of wound healing and should not be removed from around the pin site. It usually sloughs off after the underlying tissue has healed. The nurse is assisting a 4th-day postoperative cholecystectomy client in planning her meals for tomorrow's menu. Which vitamin is the most essential in promoting tissue healing? Vitamin C, vitamin B1, vitamin D, vitamin A. The correct answer is vitamin C. Vitamin C, ascorbic acid, is essential in promoting wound healing and collagen formation. A neonate was admitted to the hospital with projectile vomiting. According to the parents, the baby had experienced vomiting episodes after feeding for the last 2 days. A medical diagnosis of hypertrophic pyloric stenosis was made. On assessment, the infant had poor skin turgor, sunken eyeballs, dry skin, and weight loss. Identify the number 1 priority nursing diagnosis. Fluid volume deficit, altered nutrition, altered bowel elimination. Anxiety. The correct answer is fluid volume deficit. Fluid volume deficit is the major problem. Symptoms of dehydration are evident. The effects of fluid and electrolyte balance may be life-threatening. Rehydration can be accomplished effectively through 4 fluids and electrolytes. On admission to the inpatient unit, a 34-year-old client is able to follow simple directions, but with great difficulty. He is worried about how he can keep clean in such a public place and repeatedly dusts his bureau, straightens his bed, and adjusts the clothes in his closet. The client is experiencing a severe level of anxiety. Which response by the nurse would be most therapeutic in initially attempting to reduce his anxiety? You will not be allowed to remain in your room if you continue to bother things. I can see how uncomfortable you are, but I would like you to walk with me so I can show you around the unit. Tell me why your room needs to be so clean. I've inspected this room and it is perfectly clean. The correct answer is I can see how uncomfortable you are, but I would like you to walk with me so I can show you around the unit. Acknowledging the anxiety and channeling it into some positive activity is therapeutic. A client returns to the cardiovascular intensive care unit following his coronary artery bypass graft. In planning his care, the most important electrolyte the nurse needs to monitor will be chloride, bicarbonate, potassium, sodium. The correct answer is potassium. Potassium will need to be closely monitored because of its effects on the heart. Hypokalemia could result in supraventricular tachyarrhythmias. Which of the following serum laboratory values would the nurse monitor during gentamicin therapy? Creatinine, sodium, calcium, potassium. The correct answer is creatinine. A common side effect of gentamicin is nephrotoxicity. The serum laboratory test that best reflects kidney function is serum creatinine. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.